Hi guys, welcome back. It's Dr. Saru. Last week, when I started this series for this year, we were talking about fungal infections, more so skin fungal infections. And if you noticed, I didn't touch on much about the skin, or rather, sorry, the nail fungal infection, onychomycosis, which is what I'm going to be talking about today. So welcome guys, and let's learn a thing or two, but more so today about the fungal infection of the nail. What I want to tell you is the alternative remedies that are there to assist you with treating the fungal infection. So I'm not going to be touching about the medical treatment, but things that you can do to either prevent your fungal infection, your nail fungal infection, or rather the alternative measures you can take to help your fungal infection. So first, before I get to the alternative help or alternative medicine aspect of it, I want to inform you about the risk factors involved in people who are more susceptible to getting nail fungal infection. One, male. Apparently wanaume huwa wanaonewa sana, karibu magonjwa yote hao ndio wanapatikana zaidi kuliko wanawake. Anyway, the male gender. So one, if you're a man, you're likely to get a nail fungal infection as opposed to your wife or your daughter or your sister. Another thing, advanced age. So in the elderly is more commonly than younger patients. In diabetic patients, it is more commonly found on toes than on finger or fingernails. The fifth thing, immunocompromised individuals. So the people who are maybe on chemotherapy, people who have HIV and things like that. Yeah, even for diabetic patients, sometimes it's considered to be an immunocompromised state. So for diagnosis, it's mainly clinical. So if somebody comes, like the photo you saw before, yeah, of the nails. So if somebody comes to the office, you're definitely going to know if it's a fungal infection of the nail. But if you want to go further, you can do a potassium hydroxide preparation or a PSA stain, all the same, that can help you to find and actually make the right diagnosis for that fungal infection. Now on to the juicy stuff. The alternative ways in trying to prevent this. First, what you need to do is, so the first thing is diet. What is said, it's if you lower your simple carb intake, or actually go on a low carb diet, high fat low carb diet, you're likely to reduce the progression of the disease, other than when you're in high carb diet. For the people who like to eat plenty of bread, maviazi and whatnot, such things. The other thing is the environment around the toe. So if you'll notice, for people who get this disease or this fungal infection, they tend to sweat or have like some wetness around that area. So if you can prevent that by making sure that you actually scrub your nails well when you're washing them, and also you make sure that you dry every time you take a shower, you make sure you have dried them well in between the toes, on the toes. Okay, there's somebody who I was even reading who was suggesting you blow dry your toes on medium or low heat, so that you make sure it's actually dry. Can help to make sure that you're slowing the progression of the disease. Another thing, if it's not mandatory for you to wear closed shoes to work, maybe you can try to do open shoes, so that you make sure the place gets good air circulation. Now the third thing is direct sunlight. It's said at least 5 minutes every day when you're exposed to the sun, or expose that area which is having a fungal infection, tends to actually help curing the disease, because apparently fungus doesn't really like being under sun. It doesn't like the sunlight that much. That is why you see all these other fungus, like I think mushrooms are fungus, is it? Yes, they grow under shades and they don't grow over, or rather exposed to the sun. Another thing is the apple cider vinegar soak. You're supposed to soak your legs at least 5 minutes. You can do it daily on weekly basis and see. The other thing, improving on personal hygiene. Now, I'm not trying to say that when somebody gets the fungal infection is because their personal hygiene is poor, but if you increase the personal hygiene, make sure you take a brush and actually scratch your nails and brush them well, you'll tend to realize that this disease gets to be stopped, or the progression gets to go low. So let's just do a recap of whatever we were talking about. Low carb, high fat diet, reduce the progression of the disease. The environment around that area, that is your socks, your shoes, it needs to be revamped. Direct sunlight, apple vinegar soak at least once weekly, and personal hygiene. One thing you need to remember, guys, is it takes at least 6 months for you to grow a full nail or a toenail until all that comes out. So even if you've done it for like a week or 2 or 3 and you don't see any change, don't give up, because remember, it will take about 6 months for you to start seeing any change, because even that's the period that you see your nail actually grow again. So please don't be worried much about it, because ultimately, if you do these things diligently, you're going to see very great results. And again, another thing, why I sometimes discourage use of actual medicine is because what we describe as antifungal use for whatever fungus is because it takes your liver a lot of work. It's like your liver is doing push-ups to actually try to cope up with the drug. But again, depending on how bad it is, I'm not totally against medical medication. You can use it if your doctor has prescribed it and has actually confirmed that your liver is actually functioning well. So till next time, guys, take care. It's Dr. Saru.